So I didn't record yesterday because a couple things happened that I thought maybe I needed to process a little bit more before doing this. And today I actually did my hair, so you all can see my hair, how big and curly it is. It's not under a head thing. Anyways, yesterday I found out that my cousin's husband has COVID. And went to the hospital. That's all I know. But I know that the whole family has been exposed. Her family has been exposed. Her two kids, herself, and her mother has been exposed. So we had a little bit of a family dynamic, little issues that my aunt was going to come stay with my parents, and I was adamant that that didn't happen. I'm hoping they listened. So my mother has Parkinson's and some other health issues that I did not want my mom exposed to my aunt who was exposed. But we'll see how that turns out. And then another thing that I guess I hadn't really thought about it. I mean, I did, but I didn't think about talking about it. Maybe. Anyways, another cousin had shown me this video that an NP had put out. And at first I was listening to it and kind of thinking she was talking about it through third person because she hadn't been exposed to what we were dealing with. She had talked to a friend of hers who had disclosed it. Anyways, in that video, they talked about what was going on with the patients, and I hadn't really thought about it in those terms, maybe. I had seen it, but hadn't thought about it. But what I'm witnessing is not from travelers, from the nurses that are here, is the complacency. They, I don't know if this is their normal standard or they're just not caring. Or they're just tired. I don't know. But that the day that I was in ICU, I was appalled at how the nurses were responding to me and how they were not responding to their patients. And then yesterday, I was supposed to be in ICU again, but they stuck me into ER, and I had two medical patients that were admitted who stayed there the entire day. And after I saw that video, I kind of looked around and it like hit me. Like, we're just letting these people sit and rot. They really aren't being taken care of. My admitted patients, none of them were on beds, and they had been there easily 12 hours. One, I believe, was there for over 24. And they're just sitting on gurneys, and there's no way to turn these people. They're just staying in one position, essentially. We try to move them a little bit, but there's nothing to help change their position. They're just on gurneys. And those mattresses are the most 2 inches thick. And if you've ever been a patient in an ER and have sat on those gurneys, after about 10 minutes, your butt hurts. And they were on them for hours. So it's a little disheartening to see these people just no real care, At least not the normal care that that I have given. And I'm not sure that we're giving them the right care, like the right medicine. Everybody is on 2 to 3 different antibiotics, and some are on Plaquenil or hydrochloroquine. None are on an antiviral, and none are on vitamin C, zinc, nothing. I don't know if this is just this hospital, because there's residents and they don't really know. I don't know, but we're treating it not in a way I would think should treat it, and just letting them sit there and rot, not doing the care. I mean, why are we giving antibiotics for a virus? Doesn't make any sense to me. Antibiotics are ineffective to a virus, and so it just doesn't make any sense to me. I don't know if hydrochloroquine works on this. Everybody comes in with different symptoms. Yeah, I don't know. It's really bothering me, I think. The stress of it is rough, and I think people don't maybe understand the stress that I'm going through. I don't know. Yeah, so I didn't talk about it yesterday because it was a lot that I was kind of having to deal with. I'm really hoping my mom doesn't get it. My mom's having a really rough time with her Parkinson's, and me being here, I don't talk to her as much, which is hard. It's hard to do these videos. Hard to talk to my mom. I don't think she understands, or maybe she does. It's hard to give her the love that she needs right now, and reassurance, because I don't have it. I don't even know what to say. I know my family needs a lot of encouragement right now because of this. Hard to see my patients and knowing that I could do better and can't. I don't have the resources. I don't know. Get roadblocks when you ask about proning him. God, when I was in ICU and I wanted to prone, there was like nobody that wanted to help. They're like, oh, that's a great idea, but they don't do it. And it's not from staffing ratios. Like, we have enough staff to do the care that we should be doing, and we're just not. Anyways, thanks for going along with me on this. Please stay home.